I want to talk about hormone replacement therapy in the perimenopausal woman. My name is Dr. Philip Oob. I'm a functional medicine doctor in Austin, Texas, and I do a lot of hormone replacement and hormone balancing in pretty much all of my patients. But today, specifically, we're going to be talking about the perimenopausal woman. So, who is a perimenopausal woman? Perimenopause is a fairly loose definition, and it can start as early as age 30, some people even into their 20s, and it basically extends until menopause hits. Now, the traditional definition of menopause is no period after a year, but now with the advanced lab testing and stuff that we have, we can basically tell if you're in menopause before that whole year goes. And so balancing a female's hormones in perimenopause can be quite difficult. And the main reason why is because every month the hormones change. The first week they're a certain level, the second week they're a different level, the third week another level, and the final week they bottom out and then you have a period. And so it's difficult to balance hormones during that period. The main thing I want to encourage women that are struggling with hormone imbalances or heavy periods or fatigue or major cramps, anything like that, is that sugar is the biggest trigger to making too much estrogen. It makes too much insulin, obviously, when you eat too much sugar, but insulin affects estrogen's breakdown and estrogen's production. So oftentimes what happens is when you're eating too many carbs or too much sugar, your estrogen levels start to climb, and the higher they climb, the farther they have to fall, and the worse your symptoms are going to be as far as endometriosis and abdominal pain, PMS, all that stuff is going to be worsened by sugar. So many women these days take birth control because that balances out their periods. They may not even need birth control, but they're taking it because synthetic hormones, the birth control hormones, are extremely high dose and extremely powerful, and they basically flatten out your own hormones. So as long as you're not having any side effects from the synthetic hormones, then you feel like you're doing better. But really it's kind of covering up the problem. You should be able to manage your own hormones with the diet and lifestyle that you need. Now, I said you should be able to, so there are more complicated cases out there that do need birth control and whatnot, and each person has their own individual issues. But the other thing I hear that's done a lot by hormone doctors and functional medicine doctors is progesterone replacement. So I used to use a lot of progesterone replacement, and I've backed off a little bit. And the reason why is because you don't want to start replacing progesterone unless you've balanced the estrogen. If the estrogen levels are high or estrogen dominant, and you start adding progesterone, yes, that does balance the two, because if you have high estrogen, creating high progesterone kind of balances down that estrogen. It's all about the balance, not so much the levels. So that's one way to do it, and frequently doctors do this because progesterone makes you sleepy. When taken orally, and only when taken orally. When you dissolve it or when you put it on as a cream or a pellet, the progesterone does not cause fatigue and sleepiness. Only when you swallow the progesterone pill does it cause sleepiness. So oftentimes doctors will prescribe that because around the time of a woman's estrogen dominant or not doing well with her periods, her sleep usually gets worse. So we use progesterone that makes you sleepy, you get a good night's sleep, and the sleep also helps balance your hormones. The problem with this is something called cortisol steal. So what happens is as you start taking more and more progesterone, the body starts converting this progesterone into cortisol if you're stressing. And who's not stressing in America? So the issue is many times actually an adrenal problem. You may be making too much estrogen and maybe not making enough progesterone, but it might be that even before you start taking progesterone that you are so stressed that your body's stealing progesterone molecules and turning them into cortisol, which is your stress hormone. So if you're struggling from low progesterone, one of the things I would encourage you to do is actually try to work on your adrenals and your stress hormone instead of just trying to add more progesterone in. When you add the progesterone in, typically you feel better and you do get that night's sleep and you think it's kind of a miracle, but then you start to get bloated and belly fat and just kind of sluggish. The reason why is because cortisol is going too high. I've seen women taking massive doses of progesterone, and I don't want to disagree with anyone, but I don't do more than 200 milligrams at night. I've seen doctors prescribe up to 4, and the highest I've seen is 600 milligrams of progesterone, and that was basically being used as a sleep drug. Progesterone's not really a sleep drug, it's a hormone, so if you're having to take massive amounts of progesterone just to get to sleep, then really we should probably be considering alternative options, and it may even be prescription medications like Ambien, Xanax, whatever. So that's my caution out there. I'm not a big fan of taking massive doses of progesterone. My max dose is 200 milligrams. And if you're a smaller frame, smaller woman, then you definitely don't need 200 milligrams. So It's hard to balance hormones in the perimenopause area, and another complaint I frequently hear when I'm testing females' hormones is their hormones are very well balanced, how I'm looking at it in their labs. And they're like, well, how is that possible? Last month I skipped a period, and this month it's all over the place. And the reason why is because when you test hormone levels, you're checking one snapshot in time. It's like taking a picture of a movie. Do you understand the plot? Do you understand who the characters are? Not really. You know who's at play at that scene right there, but that's all you know. So it's important to follow women and follow your doctor along, and checking the hormones repeatedly, talking about your symptoms, and really much of the time with a perimenopausal woman, the symptoms guide the treatment, not so much the lab levels, because they can change. I always test women on day 19 to 21 of their period. That's the time when the estrogen and progesterone are supposed to be balanced and fairly the same each month. But a lot of doctors test earlier in the period in different times. But that's the way that seems to make the most sense, and what I've studied and read, that's the easiest to balance hormones. Not a big fan of synthetic hormones, so I generally try to get women off of synthetic hormones, but anytime they're on synthetic birth control of some sort, I'll typically try to balance the adrenals before we just remove the birth control. Because if the adrenals aren't balanced, if the hormones aren't balanced before you remove the birth control, then they're going to have a really bad month and they're not going to like you. So I think that's all I wanted to talk about. One more thing, as far as the progesterone only makes you sleepy when it's a capsule. So there's multiple ways to get progesterone as far as dissolving tablets or creams. So only use progesterone capsules if that's the one you want to use and if you want it for sleep. But if you don't need it for sleep, then you might want to consider one of the other therapies. The advantage of the capsules is that they're kind of a pharmaceutical product, so it's really easy to get at any and every pharmacy, and they're usually affordable. But getting a large supply of dissolving tablets or cream can actually be cheaper in the long run. It's typically just a higher investment up front. So hopefully this helps some of you perimenopausal women out there. I recently joined a group of hormone discussion, and I'm getting a ton of questions from that. So you'll probably see more hormone discussion coming from me. Okay, thanks guys. Share this video with someone you know who may be struggling with hormone imbalance.